Middle ear infections. Ouch. If you ever had one before, it really sucks. What's going on, Secoya Nation? Actually, I'm bringing wellness wisdom today. Today we're talking about middle ear infections. And if you don't know, there's an outer ear, there's a middle ear, and middle ear is the inside of your tympanic membrane, which is your eardrum. So, when I was 18, I jumped off a pontoon from the canopy part and submerged too fast and blew a hole in my eardrum. And I got a middle ear infection that lasted more than 2 months. And I had a bunch of orange crap busting out of my ear, and it wasn't fun. So if you can avoid it, I encourage you to. It's less likely if you have if you don't have tubes. If you ever have had tubes in your ears, you got scar tissue in your eardrums, a bunch of stuff. So this story is brought to us by a little boy we had come in and see Jess recently. I've seen him as well, as far as consulting with Dr. Jessica, and talking about middle ear infections and parents' fear. I mean, I was given tubes when I was a kid for several rounds because I had chronic ear infections. But you want to stop and say the middle ear infection is a symptom. It is not causative. It is not telling you anything more than you have an imbalance. Probably because the eustachian tube in kids is pretty horizontal. It's not angular. Eustachian tube is what connects your middle ear to the outside environment. It actually connects the outside. So when you go up and down a plane, if that eustachian tube is not clearing, your ears can't pop as you come up and down, and that you can't equilibrate your pressure in your middle ear. So this little kid was hurting. Like his ear was aching. He was tugging on it. It's a classic sign of little kids tugging on their ears. So we were trying to give him the best relief possible. And so, our job is to bring this idea to you. We feel at least I feel compelled to bring this idea to you of helping you understand what the brain-body connection is, so that you can then observe your life and understand your kids or yourself and whoever else is involved. So if you want this kind of information, you want the inside track to get ahead of the game and understand things at a deeper level, just sign up for our email list, because we can provide that to you in your inbox and you can read at your leisure and stuff like that. So when you think about the middle ear, it's about processing. It can be related to olfactory. It's your sensing of your environment. It can be related to memories of hearing things, smelling things, memories of mom, if you will, feeding with mom. Those are all related to the middle ear. And then there's different bacteria or viral things that are thought to be causing these things. Some people say you got bacterial middle ear infection or viral. And so there's like pneumococcal and influenza and Haemophilus influenza, and there's different bacteria that come up that are related to this. So I think Staph aureus is actually related to it as well. These are medical paradigms that they're saying the bug is the causative factor of that. Very rarely, if ever, do you ever hear them actually either taking a sample and culturing it. They just basically shoot from the hip and say, we got an ear infection. I'm seeing the eardrum is pushed out. It's changing the cone of light. This is all nerdy talk. We talk about like looking under the stethoscope and saying, otoscope, and saying like, what's going on there, and saying, what is the eardrum doing? So you got the bones you can see through the membrane. If the cone of light's changed and it's all red and pussy and fluid, cloudy, you're considered having an ear infection. But the infection is a healing crisis. So let's get a deeper sense of meaning on what's going on with the healing crisis. So if it's the influenza type, it's like a family member's insistence on having influence over us. So you're hearing things, right? The ear's about things I want to hear, things I don't want to hear, or lack of balance, okay? So having someone in the family want to have influence over your decisions, that's going to be one aspect. Then there can be conflict regarding the father and or the mother. So the father's possibly in relation to the mother, but there's also like related to the mother. So it all comes back to relationships, right? And the stress. And if you understand that if there was an environment which was calm, because one of these things is like frequent exposure to stressful things, stressful environments. Remember, the child is hearing things they don't want to hear. They're not hearing what they want to hear. They're feeling this stress over and over. And that environment can lead them astray. It can start changing how they're perceiving their environment. And as a result, if there's yelling accompanied with stressful situations or anything like that, that can all cause stress in the middle ear. And if it's a lymphatic issue, the child can't let go of living in fear of hearing these things they don't want to hear or not hearing what they want to hear. That can be challenging too. So
Faith is asking, yeah. Swimmer's ear, is that in the canal or where is it in the ear? Swimmer's
great
ear.
Question, Faith. Swimmer's ear is technically considered otitis externa, so it's outside of the membrane, that's in the ear canal. People oftentimes have itching, or fluid can get trapped behind wax, and then it's like a pool in there and stuff like that. So that's a great question. Thanks for asking. when a situation is unbearable and it's like the situation is constantly oppressing the child's nervous system, and I say child because you don't typically have adults that have middle ear infections, but it can happen, like when you're dumb enough to jump off the canopy of a pontoon and you blow your eardrum out, that can happen. That's trauma though. We're talking about the insidious aspect of an environment that's constantly like caustic or toxic to a child's brain, stressing them out, they're being affected by things and things they don't want to hear. So the child wants to get the information they want to hear, but they also might not have an avenue of saying what they feel like. So if you have a child or you know someone with a child that has struggled with an ear infection, or maybe you, I don't know, understand that it's something about your environment that you probably don't want to hear, or you're not asking for what you want to hear. And so these are really important things to take into consideration with the ear. And I don't know, did we talk about tinnitus before? No, okay. We'll do a follow-up on tinnitus, because it's like the ringing, the buzzing, you go to sleep at night and the room's quiet and all of a sudden you hear this high-pitched, that's tinnitus. So we'll talk about that tomorrow. But it's about how am I in relation to my loved ones? How do I position myself? How am I perceived by them? How am I perceiving myself in context with them? What am I hearing in the environment that's causing me to feel stressed by that environment? So if two parents are fighting, if older siblings are fighting, if some kid's a middle child who's stuck in the middle, it can affect everyone at a different level. So, our daughter had some ear infections following her dad's footsteps, I guess, being affected by some stresses that Sarah and I were having early on in our marriage. We were new parents and we didn't know what was going on. And so a lot of stress there. So any of you young parents, new parents, first-time parents out there can relate to that. I'll just implore you to keep the stress away from the child. Talk about it out of their earshot so that they're not confused by it, because children don't know what to make of the meaning. Thanks. Christina's shutting the lights off on us. So if the child doesn't know the context, if you don't tell them straight up, like, sweetie, this isn't about you, this is between your and your mommy, I want you to know it's not about you, they're going to take that on as their responsibility, because they're just a feeling human being. They're not thinking things through from basically birth to 7. So
Faith is asking, because her daughter has swimmer's ear and is a lot of pain. Is there something you can that they could do before they see the doctor?
Sure. So my first line therapy would probably either do some peroxide in there, provided there was no perforation of the eardrum. Do some peroxide in the eardrum. We did this in school where you lay on your side, pour it in there, it'll pop and fizzle and just kind of like a soda, if you will, but it's going to cleanse that out. If that doesn't work, I would actually probably use either colloidal or a homeopathic purified silver first. That'd be my first choice. A lot of people don't have access to that, so if you just did some peroxide, it would be fine too. But swimmer's ear is I'll see if I can dig up. Thanks, Faith. I'll just take that on as an opportunity to research something for you. But it's not a causative factor. It's not causing anything. It's a symptom of something. So I'll see what I can do to find that information for you. We'll report back on either. I don't know if we can comment on your thread, or we'll just do a video on it. Okay. But if your doctor's recommending some invasive surgery, you're puncturing. If you get tubes, you're puncturing the eardrum. You're basically putting a port between the external environment and the internal environment, and allowing what would normally be a controlled environment to be affected. I still have a small perforation. I've never gone to get tympanoplasty where they fix my eardrum, but this ear equilibrates and this one doesn't change much. So I know that it's basically it's like a door in a saloon. Ooh, air's going in and out. But before you get your child's ears punctured with tubes, understand that they're having trouble letting go of stress. They're having trouble being affected by your stress. They're having trouble processing things that they're hearing that they don't want to hear, and or not being able to say what they need from you as far as reassurance. Your job is to keep your child safe. This is one parent speaking to another. If you have a child, it's like your job is to keep them safe, help them make sure they feel loved unconditionally, and as best you can protect them from danger. But there's stuff out there all the time, so just do your best. So safe, loved, and protected is what I would encourage you to strive for. You don't have to keep them in a bubble, you don't have to protect them everything, but you need to give them a context about what's going on in their life and your life, and do your best to not keep them from struggle, but shield them from your struggle as far as what they might not understand and what you might then inadvertently, unintentionally impact them with. Okay, so I'll just leave it there. We're all just doing our best. Okay, do your best and let go of the rest. So we appreciate you. We love you. We'll see you tomorrow for the Willis Wisdom. All right, guys, take care.